Thank you, Mr. Speaker. Pennsylvania wants to be #1 on many initiatives. However, we don't want to be #1 when it's dealing with Lyme disease. Over the last 6 years, Pennsylvania has ranked the highest and #1 in the country for the number of confirmed cases of Lyme disease. Pennsylvania reported about 40% of the nation's cases in Pennsylvania alone, and this number is expected to be even higher, since many of the cases are not yet to be reported or diagnosed. Lyme disease and tick-borne illnesses are a public health crisis, and Pennsylvanians need to understand the high risk, the varied symptoms, and how to best prevent the disease and the resources that are available to them. Individuals should be aware of early and late persistent symptoms and that a negative Lyme test cannot rule out Lyme disease. I'm sure all of us know many individuals who have been diagnosed with Lyme both at the early and the late stages of the disease. This is a debilitating disease when it is not diagnosed early and progresses. As citizens, along with our medical community, we need to be diligent and strongly aware of the diverse and chronic symptoms which can affect every system and organ in the human body and often every aspect of an individual's life. Lyme disease is often referred to as the great imitator because it mimics so many other possible diseases. Ticks are also now showing that they carry a variety of pathogens, not just Lyme, which are referred to now as tick-borne illnesses. There is a lot of unknowns at this time, and the research is needed to develop better testing, a possible vaccine, and better treatments. Many of you know I have several pieces of legislation and initiatives on this subject. We need to prepare our state better to prevent individuals from acquiring Lyme, understanding the pathogens, and working to diagnose the disease as early as possible before it becomes debilitating. As we approach summer and more outdoor activity, I ask you to ensure that as legislators, you include in your communications, and especially during the month of May, Lyme Disease Awareness Month, that information and education to help your work towards prevention and early diagnosis of Lyme disease. Thank you, Mr. Speaker.